Ranking Member Brownley, you're now recognized for 5 minutes for questions.
Thank you, Madam Chair. Mr. Murray, good to see you. You gave a lot of statistics around having surveyed your veterans and why they like, or a large percentage like getting their health care from the VA. Can you point out why they like it? Is it because it is, the physicians, people there understand them better than going out into the community? I mean, are there elements in which I believe that there are elements that the VA provides that just are not provided in the community? And I agree with you. I don't think we can look at these two entities as one or the other. We have to look at it as a delivery of healthcare services to our veterans. And I don't think the VA can do it all by themselves. Women veterans, as an example, if they're pregnant, the only choice they have is community care. So, I agree with you on that. But I'm interested to know why veterans like their health care in the VA.
So we didn't ask that in the survey, but we have heard before that ideally VA can be kind of a one-stop shop. You can go to your primary care, you can go do podiatry, you can go get your x-rays, your blood work done, and then stop by the pharmacy on the way out. The idea that you can get all your care, if you can manage to schedule it all in one day, that is a tall task to be able to do. But if you can do that, that's ideal. You can't do that elsewhere in the United States. Private healthcare does not exist that way. Yeah. So that's something that is incredibly important. You are right, though, about women veterans. My wife and my little sister both use VA, and both, going through pregnancies, were immediately sent to the community. That's something that we need to kind of embrace. When VA can't do it, don't try to hold on to it. I also use the DoD system. DoD does not view me going to the community as a threat. The same way that VA sometimes does, that they're trying to hold on to my care at VA. DoD does not do that. I am a retiree, so admittedly, they may view me as somewhat of a burden to the system, but me going to the community is not a big deal at the DoD system, but it is at VA. We need to kind of break that mentality and use it to support. VA can't do it all themselves. They never have been able to. The Choice Act and the Mission Act made sure that VA should know they need to lean on the community where necessary.
Thank you. Thank you very much. And Ms. Burke, thank you for being here. It's very good to see you, and thank you for what you do and providing a voice for so many VA employees. Really appreciate that. So from the perspective of frontline providers at VA, the Veterans Choice Act of 2014 and the VA Mission Act of 2018, talk about how that has impacted frontline employees. Has it affected the provisions of services at VA medical, delivery of healthcare services at VA medical facilities?
Thank you, Congressman Brownley, for the question. I think, generally speaking, having, we have like 14 pages of scheduling rules, and so that the complexity of the rules is quite confusing, number one. But as time goes by, when you're looking at 15 to 20% increases over and over, the effect of that really is it kind of erodes the internal process of what VA is delivering. And so I don't think we are never going to be in the situation of opposing giving care when it needed. Since I've been at the VA for 30 years, we've always done that. But I think really we need to kind of stand back and think about how we're going to fund the VA, what we're going to fund, when we're going to fund it, because I feel like this is unsustainable. We're on a path of unsustainable situations. But there isn't one rule that fits all, I think, in this case scenario. And I think you have to look at specialty care a little bit different than you look at, and things that people need, like dialysis, cancer care. Yeah.
So I don't have much time, so I want to get another question in here. So, this whole, I think we're all agreeing on, that community care has increased over time. And I'm interested to know what the impacts are on frontline employees, their morale, their recruitment, retention, all of that. Can you talk a little bit in 10 seconds about the impact?
Sure. Ultimately, when I see 12 patients a day, that looks a lot different than when I see potentially, if we had access standards and a cap of money, 20 patients or 25. I'm being extreme right now, but as you can see, that's going to create burnout and so forth.
Thank you. I yield back.